Hi, welcome back to my channel. Today I would like to discuss about medication errors. Medication errors are these are the preventable errors which are occurred because of inappropriate use of medications. These errors can occur at any stage of taking medication, like at the level of ordering by the physician, or at the level of transcribing, or at the level of dispensing, or at the level of administering the drug, or at the level of monitoring the medications. So these medication errors they can occur at any point of taking medication. These medication errors they are causing so much of health burden to the society as well as the patients. If you see the types and causes of medication errors, these medication errors they are occurring because of the omission errors. So like if the drug is not prescribed to the patient, even the need is there to the patient, so that error can cause medication error. Or if the drug is prescribed but it is not dispensed to the patient, that is also causing one medication error. And third is the drug is prescribed or dispensed properly but the drug is not administered to the patient by the healthcare worker. The medication errors are because of errors of commission also, like giving wrong drug to the patient, or giving wrong dose to the patient, or you're giving drug to wrong patient, or you're giving wrong route of administration. And sometimes the medication errors can be happen because of the communication failure, like illegible handwriting by the physician. So generally physicians have the habit of having illegible handwriting whenever they are writing prescriptions. So those illegible prescriptions they are not able to read properly by the dispenser, like pharmacist, or not able to read by the nurse who is giving the drug or who is administering the drug to the patient, or not able to read by the patient itself whenever the patient wants to take the medication. More communication failure is giving vague instructions to the patient. So vague instructions which are given by the physician to the patients, which also causes medication errors. So, to these vague instructions, whenever a physician wants to give instructions, it has to be given in a proper manner so that the patient can understand, and the if possible try to give the instructions in the understandable language or local language which can be suitable to the patient, and so that these instructions to be clear and should be understandable to the patient, so that we can avoid all these medication errors which are happened because of vague instructions. And one more is incomplete prescription. So incomplete prescription is also causing so much of medication errors. So before giving prescription order to the patient, we have to complete the prescription, then only the prescription is valid prescription. Otherwise incomplete prescriptions are not valid. All these medication errors they are causing so much burden to the patient as well as the society. So it is consuming so much of efforts of doctor, efforts of nurse, efforts of the dispenser pharmacist, or efforts of the patient. So to prevent these medication errors, what steps we have to do? The first step is the first line of defense against medication errors should be the prescribing clinician, right? So clinician has to have all the information about the condition of the patient as well as the treatment modality to be prescribed for the particular patient. So that information should be there with the physician. This information should be in accordance with the evidence-based recommendations based on the condition of the patient and based on the requirement, based on the need of the patient. So the doctor has to give the proper prescription to the particular patient in view of the benefits and risks of the drugs. doctor has to advise the medications to the patient based on the need of the patient. So the doctor has to prescribe the medication in a effective manner so that we can avoid the medication errors. Second thing is, second line of defense against these medication errors lies at the level of the the dispenser who is dispensing the medication. Like it can be the pharmacist or it can be the nurse. So dispensing the medication, the correct medication to the patient is one more important aspect, so that the correct dispensing of the medication is required to prevent the medication errors. Otherwise, the your if the dispenser is dispensing wrong drug to the patient, which can cause medication errors. So it has to be dispensed properly so that the drug can reach or dispense to the patient properly, and we can decrease the medication errors by dispensing the medication, right drug to the patient. And third line of defense is lies at the level of the administration of the drug. So it can be some injections, some infusions or some injections. They are administered by the nurse. So if the nurse is injecting or infusing the drug properly, so we can avoid many side effects, many medication errors, which are due to because of wrong administration. And before giving these medication to the patient, we have to check whether the right drug is prescribed or right drug is prescribed or not, or right dose is prescribed or not, and the drug, whether the prescribed drug is given properly in the right administration route or not. So route is also one important aspect: right drug, right dose, right route, and right patient. So we have to give all this medication to the particular patient only, to the required patient. Should not give, should not administer the drug or should not prescribe the drugs to the not, I mean the patient who is not needed. So you have to give the required medication to the required patient only. So you have to select the patient, the selection of the patient should be done properly. Otherwise, it can cause medication errors. And fourth line of defense, which is occurring at the level of patient itself. Patient, even though you are prescribing the medication in correct dose or correct route, or you are giving the right drug to the patient, or you are rightly dispense the drug to the patient, but patient itself is not taking those medication, or is not following the advice which are given by the physician. So these instructions, if the patient is not followed, those instances, they can cause medication errors. So these levels, either it could be the physician level or it could be at the level of dispenser like a pharmacist or nurse, or at the level of administration like at the level of nurse, or at the level of patient. All these levels has to be thoroughly monitored, thoroughly checked before giving medication. Then only we can avoid all these medication errors. Thank you.